Okay, so knock, knock, knock. Come in. Okay, so I am providing patient privacy by closing the curtain. Oh, I am doing hand hygiene and I'm removing any distracting objects or distracting noises from the room. So, hi. My name is Karen Gibson and I'm a student nurse from Roseman University of Health Sciences, and I will be your student nurse for the day.
Okay.
Okay. And can you state your full name?
Maureen Aldridge.
And your date of birth?
8/18/85.
And how would you like to be addressed?
Maureen's fine.
All right, Maureen.
Yeah.
So today we're going to be doing a head-to-toe physical assessment. That will include me using my stethoscope to listen to parts of your chest and your abdomen. I will be asking you a variety of questions, and I'm going to have you get up and walk around, and I'll be moving you to different positions if that's okay with you.
Okay, that's fine.
Perfect. And today we're going to start off with just a couple of general vital signs.
Okay.
So if I could take your hand, and I'm going to feel for your radial pulse. Alright, so patient's radial pulse is 60 beats per minute, which I counted for the first 30 seconds. For the second 30 seconds, or for the second half of the minute, I counted her respirations, which were 8 respirations per minute, which both are within normal range. Okay, and so now I'm going to tell the differences between the two radial pulses. Okay, so both radial pulses are 2+ bilaterally, equal in strength and rhythmic in regular consistency. Yeah? Okay.
Even.
Even. There we
Yeah.
go. Okay, so now we're going to take your blood pressure.
Okay.
Okay, first, when I'm taking your blood pressure, I'm going to palpate, feel for your brachial artery. Perfect. Okay, and so for this blood pressure reading, I'm going to do a 2-step blood pressure reading first to get a spot where your radial pulse is occluded, and so I can get a better, more accurate reading. So radial pulse was occluded at 100 millimeters of mercury, and I will add 30 to that number and auscultate for the brachial pulse. Okay, so your blood pressure is 95/56. Does that sound like a regular check? Okay, so now I'm going to put this little device on your finger, and it's going to tell your oxygen saturation. Okay, and your oxygen saturation is 98% on room air, and I'm going to take your temperature. Oh, put it underneath your tongue and close your mouth, but do not bite down. Okay, good. Okay, and your temperature is 97.9 degrees Fahrenheit, both within normal ranges. Okay, so first I'm going to start with listening to some breath sounds. I'm going to reset the moment. I'm going to reset the moments when I first walk in and I greet the patient, and I'm going to ask her on a level of 0 to 10, 0 being no discomfort, and 10 being extreme discomfort and extreme pain. How would you rate your comfort level today?
0. I'm in.
Okay.
Yeah.
And then I'm going to raise the bed to my height.
Okay.
Well, no, raise the bed. I'm going to to a comfortable height.
Okay.
And then ask if you'd like the bed raised.
Sure.
This is hard, and it's not actually like
Yeah.
Can't actually pretend.
Yeah.
Okay, and then I'm gonna raise the bed to my height. Is that a comfortable height
That's
for you?
good.
Okay, perfect. Okay, so now I'm gonna reset the moment to when I'm telling her that I'm going to listen to her breath sounds. Okay, so I'm gonna listen to your lungs and perfect. Is it comfortable sitting up, and is that a comfortable position for you?
This is good.
Alrighty. So when I'm listening to your lung sounds, every time I press my stethoscope to your skin, if you can inhale and exhale through your mouth.
Okay.
Pretend I'm putting my ears.
Okay.
Okay. Right upper lobe, left upper lobe, right middle lobe, left lower lobe, left lower lobe, right upper lobe, lower lobe, left lower lobe, and left lower lobe. Okay, so I hear clear vesicular sounds in all lobes of the lungs on the anterior side. And then while I have you in this position, I'm also going to listen to some heart sounds. I'm going to listen in 4 different spots, and when I get to the last spot, I will listen for 60 seconds, so do not be alarmed that I'm hanging out in that region.
Okay.
Okay, so first I'm going to go to the second intercostal space right of the sternum, and this is the aortic valve region. And you can just breathe at a regular. Okay, then I'm going to the second intercostal space left of the sternum for the pulmonic valve region. Then I'll go down to the fifth intercostal space for the tricuspid valve. And then I'm going to, if you could lift your breast with the back of your hand. Okay, then I'm going to go to the fifth intercostal space, mid-clavicular line, and I'm listening to the mitral or bicuspid valve. Here I'll listen to the apical pulse for 60 seconds. Okay, and her apical pulse is 60 beats per minute, and there is no pulse deficit, and a pulse deficit being defined as the apical pulse minus the radial pulse. Both were 60 in this case, so she has no pulse deficit. I heard S1 and S2 in all 4 regions of the heart. Of the heart. Okay, now I'm going to listen to the lung sounds on your back.
Okay.
Okay, so if you could actually, because where the bed is, I'll lower the handrail and then sit to the side.
I forgot the handrail. Sorry.
That's okay.
I forgot to raise the hand. That's bad.
No, I know, I keep just going to fall out where you sit. Okay, so the same applies every time I press my stethoscope, if you could inhale and exhale through your mouth. So I'm starting with patient's left upper lobe, right upper lobe, right upper lobe, patient's left upper lobe, then going to the left lower lobe, right lower lobe, right lower lobe, right lower lobe, left lower lobe, and then 2 more for the left lower lobe and the right lower lobe. Okay, so I hear clear vesicular sounds in all lobes of the lung on the posterior side. Her breathing is unlabored, and she's using no accessory muscles, so she appears in no distress or any respiratory discomfort. Okay, so while I have you in this position, I'm going to test your strength in your arms and your legs.
Okay.
So if you could hold your hands up like this, and if you could press outward,
Okay.
and press inward,
Okay.
and then face it towards yourself, and pull,
Yeah.
and then push, and then if you could grasp my fingers. Alright, perfect. And then I'm going to go to your legs. Okay. And if you could pull inward, and then push backwards, and then to your feet. If you could push down like a gas pedal and pull up. Alright, and then when I'm down here, I'm going to feel for her pedal pulses, dorsal pedalis.
Yeah.
You got this.
Paramedics call.
Okay, which are 2+ bilaterally and even and consistent with regular pulsations. And then I'm going to feel for her posterior tibial pulses, which are 2+ and equal strength bilaterally. Okay, so patient has equal strength bilaterally in all exterior limbs of her body. And then hand hygiene, because I did touch her feetsies. I would say feetsies, because I touched her feet. Okay, so, yeah, I know. Okay, so now I'm going to ask you some questions and follow my command. If you could smile, if you could frown, raise your eyebrows, and then if you could shrug your shoulders against my resistance, perfect. Can you push your head against my hand, and then push your head against my hand? Okay, perfect. And can you stick out your tongue? Okay, perfect. Okay, so tongue sticks out. Okay, you can put your tongue back. So tongue sticks out midline with no obvious tremors. Strength is equal bilaterally in both of the muscles in her neck and on her trapezius for for her shoulders. Strength is equal bilaterally. And now I'm going to shine a light in your eye. If you could focus on the pumpkin behind me.
Okay.
Okay. Okay, so now if you could look at the pen, and I'm going to, if you could follow it in with your eyes to your nose, and then back out, and then once again, and then back out. And then I'm going to test your range of motion and your peripheral vision. If you could follow my pen up. Okay, so in the 6 cardinal locations, she has no nystagmus or oscillation. Her pupils are equal, reactive, and accommodate to light, and
Equal, round, reactive,
Equal.
and accommodate.
I even told you about it. Equal, round, reactive, and accommodate to light and motion. Cranial nerves are intact. I have that. I did your feet. And I'm going to go back down with your feet. And I'll release it. Okay, so while I was at her feet, I'm also going to check for any edema or swelling on her tibia. And no edema or swelling is present. And legs are pink and warm to the touch. Same with her arms and hands. Her hands are warm to the touch. Pink and even skin tone color. Okay, and next I'm going to test your skin trigger. So I'm going to pinch in 2 different places on your body. I'm going to pinch on your forearm and look on your below your clavicle. Okay, so skin rebounds instantly. I'm showing no tenting, which shows good nutrition and good hydration. No dehydration is present. Okay, so if you could. So I'm going to listen to your vowel sounds now.
Okay.
Okay, so if you could lay back down.
Okay.
Okay, and I'm going to, your headrest is raised, so I'm going to lower it back down so she's laying, and the bed is at a height that is comfortable for me, so I'm not hunched over. And resetting the moment, this was never around my neck. This was always in my pocket. Because it's supposed to be around your neck. Okay, so I'm looking at the abdomen. The abdomen is flat on both angles. It is flat with no bulges or masses or abnormal pulsations present. Okay, so I'm going to lift your shirt and I'm going to listen to your vowel sounds. Starting with the right lower quadrant, then moving to the left lower quadrant, left upper quadrant, and right upper quadrant. Okay, and when was your last bowel movement?
This morning.
This morning, and the last time you voided your bladder?
This morning.
Okay, and I hear bowel sounds in all 4 quadrants of the abdomen. And skin is even and consistent, warm to the touch. I got the trigger, I got the feet. Okay, and I'm going to test the capillary refills. Okay, and technically when I was looking at your dorsal penile muscles, and I'm going to check the capillary refills of your toes. Okay, perfect. Hand hygiene after touching her feet. And capillaries refill in under 1 second, and hands and feet are warm. And is there any other questions you have today? Okay, and is the bed at a comfortable height for you?
It is.
Okay, and then I'm going to keep the headrest at the same height, but I'm going to lower it down to the ground. I'm going to make sure that I re-raise the head side rail after lowering it. And brakes are on. The call button is right here on the handrail. Safety, hand hygiene. Any other questions? And the physician will be with you momentarily.
Okay.
Okay, forgot something else. What did I forget?
Sensory and weight.
This one I forgot.
But it's okay, because like you said, I think I'm focusing too
No,
much.
I think
I need to go back and study. I should go. I could